Today, I'm going to teach you how to change patients' habits. I'm Dr. Harpreet Singh, and I help patients to change their habits by using a couple of business books. So, you might have heard about a book called as Habit Loop by Charles Duhigg. In his book, he mentions the word cue or trigger, and then he mentions the word routine, and then he mentions the word reward, and he calls this as a habit loop. Now, he gives a famous example of a Pepsodent toothpaste and a Febreze, which you can read in his book, but I'm going to help you out to change the patient's habits. That was the first concept which I read, which I have mentioned in my book, Vital Checklist. Then, afterwards, I read another book by Eyal, Hooked Model. And in that book, he mentions hooked model. This hooked model, he starts with the trigger, T trigger, A action, reward, and investment. He says if you have to have a patient or a customer hooked to your product, you need to follow these steps. So it all starts with an external trigger, and you need to touch the internal trigger. The internal trigger, what is mentioned by Eyal, is equal to craving. So when I was reading these two instrumental books which helped me to arrange my model of changing patients' habit, I developed a benzene loop. Now, a benzene loop, so this is a benzene loop. Okay, so what happened was I was having a shower, and after reading these two instrumental books, I was thinking about shared decision making with my patients, how to give patients autonomy. In Hooked book, Eyal mentions autonomy, but it is not incorporated in the Hooked model. So somehow there was somewhere I had to fit in the autonomy or a shared decision maker, because trigger was mentioned over here, action was mentioned over here, reward was mentioned over here, and investment was mentioned over here. So autonomy was coming right over here. So, but it did not look nice. So one day I was, having a shower, and immediately a thought came to my mind that, what if the snake comes out from this drainage system in my shower? And I was reminded of Benzene Loop and Kekulé, who developed this benzene loop by thinking of a snake having a tail in his mouth. That's how this benzene loop came into being. I thought, what if I change this hook model into a benzene loop, and I can help my patients to change their habits. And so a model came to my mind was benzene loop. So I thought that this is the formula for benzene. Okay, this is the structure for the benzene. This is the chemical structure for benzene. The people who have learned chemistry, they will know about this, but for time being, just remember this is a benzene loop. This part of the benzene loop is trigger, and this is an external trigger, and this is an internal trigger. This part is action or behavior or it is an impulse, or it is also called as routine. This part is reward, and this is attached to here, so we will call it as fixed reward. And remember, this is from hooked model, from Eyal's hooked model, and this part is variable reward. And here is what I mean by autonomy or shared decision maker. Shared decision maker or model. And this part is investment of time, effort. In Eyal's book, he also has a point called as cognitive dissonance, and this was still missing. Then after a few days of developing this, I was revising my books which I have read many years ago. One book was Willpower by Baumeister, and another book was McGonigal's Willpower Instinct. So I thought to myself, how do people get willpower? How can patients develop a strong willpower to change their habits? This is when I thought about that, okay, this is a part of emotions, right? Emotions. And this is part of an impulse. So the definition of willpower is, so before you develop emotions or then you perform an impulse or take an action, before that the thoughts come into play. So this segment was for thoughts. An interesting thing happened. I was browsing on Facebook. I thought, these thoughts always come on your mind. So what will this segment be? This segment can be, I called Mark Zuckerberg question. Zuckerberg question. Why? Or I call this as a Facebook question. This Facebook question is, I always say, what's on your mind? Now, after developing, I started thinking about how can I improve my patients' habits. Now, the external trigger is basically a patient education pamphlet. I always say, don't be a pamphlet doctor. If I hand over the patient pamphlet, is he going to read it? Read the pamphlet? Maybe, maybe not. Is he going to get a reward? Maybe, may not. So the loop does not really complete. You need to trigger the internal emotions of the patient. What is the pain point going on? Like I mentioned in my book, Vital Checklist, how I developed this book was, I had a patient who was not willing to listen to the side effects of smoking. She was 27. She was not afraid of a cancer. So I mentioned in this book that how I changed the patient habit. You would not believe it. Victoria's Secret helped me out to change the patient's habit. So this patient of mine was not willing to listen. So when I explained her about stress incontinence, so this is the bladder of the patient, and this is a diaphragm. So when the patient coughs and sneezes and she leaks, this is called as stress incontinence. And this is a bladder. So this is the ligament which gets loose because of pregnancies or that kind of stuff. And if this angle becomes 90 degrees, you start losing. This is called as stress incontinence. In urge incontinence, you have problems inside the bladder. Stress incontinence, problems outside the bladder. When you smoke, you irritate the bladder lining and you cough or you sneeze, or you may not cough or sneeze. Because it is getting irritated, you will leak. So this is called as urge incontinence. Urge incontinence is inside the bladder problems, stress incontinence outside the bladder problems. And so, I said, while I was explaining to my patient, and you can have a leakage on smoking. And she had an emotion or a non-verbal cue of doing like this. I knew something was fishy. This was a surprise element for her. When this surprise happened to her, immediately another book came to my mind, Made to Stick. In that book, the authors mention that if you have to make your idea sticky, have an unexpected explanation to that. So this was kind of an unexpected. So, and she had a non-verbal cue like this. I knew there is something. So I asked her a question. So you have a urine incontinence? And she said, yeah. So do you use panties or panty liners? And she says, oh, I sometimes use both. And remember, she was 27. I said, at 27, you're using panty or panty liners. At 47, you may be using adult diapers. And she asked me the question of the lifetime. So she asked me a question, that means I will not be able to wear a Victoria's Secret? Wow! And I was like blown away. What kind of question? Immediately, a thought came to my mind. I have been telling her cancer, 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 cancer. Or doctors have been telling her cancer, 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 cancer. Death, heart disease, stroke. But her, she's stuck in a Victoria's Secret. Now, her internal emotion, her pain point is urine incontinence. What behavior? She will stop smoking, and the reward is in anticipation. At 47 years of age, she will not be able to wear a Victoria's Secret, so she should do not smoking and prevent urine incontinence. So the shared decision maker, the shared decision model or autonomy model is having three minds. Means doctor's mind or a caregiver's mind, patient's mind, and the caregiver's mind. And the research has shown when we involve these three minds, doctor's, patient, and a shared mind, you stimulate the mirror neurons, empathy neurons. And this is also bringing the patient and the doctor on the same page. This is also called as attunement. And this bringing them on the same page gives rise to autonomy, and patients get power. And now they will invest their time and effort to change their behavior. And whenever they have a thoughts of smoking, they will remember this Benzene Loop. I will keep on explaining this with many more examples in the coming videos, and I will keep on dissecting this by using various books and various journal articles I have read. I have developed a lean patient experience model. I do not believe in giving pamphlets because of this reason. And this is the entire purpose of writing this book, Vital Checklist, to help you improve patient experience score and make patients smart, patient smarter. And this lean patient experience model, which I'm developing, I need your help. You can visit my website, drsinghmd.com, and help me out to spread this message of making patients happier. Thank you.
Order now at Amazon.com.